Does TRT cause heart attacks? I'm Dr. Travis Jeffords, Hydro Med Spa, and let's get into this a little bit. Some backstory on myself. I spent 15 years in the cardiovascular realm, 10 of which at a major university, 5 in private practice. Was involved in a lot of different research studies in the cardiovascular realm. I'm published on dual antiplatelet therapy for patients who've had cardiac events, things of that nature. So a little backstory, I've got some experience there. In regards to hormone therapy, testosterone therapy, for the longest time, that was kind of the argument. That was what people would say. It's going to cause, heart attacks, strokes, cancer. These are all a lot of the myths that kind of get thrown out there when you talk about testosterone. The general rule of thumb is a patient essentially over the age of 40 who has low testosterone tends to have an increase in their all-cause mortality from having an increase in body fat, having a increase in the amount of diabetes that we have in that population, metabolic syndrome. There's all of these risk factors to cardiovascular disease in a patient with low testosterone. So a lot of times you can link low testosterone very easily to all the comorbidities that are associated with cardiovascular disease and somebody who has a heart attack, right? So quite easily you can associate the opposite, all right? So having low T versus being on testosterone. There was a study that was just published, the New England Journal of Medicine, October last year. That was well done, and basically it looked at testosterone therapy in middle-aged men and compared it to not being on testosterone therapy, and then looked at the outcomes, and those outcomes including, cardiovascular events, right? Heart attacks, things like that. And basically, there's no increase in major cardiovascular events when comparing somebody not on testosterone versus being on testosterone. So the idea that down the road, all of a sudden, you're going to have a heart attack because of testosterone alone is, in my opinion, absolutely false. There are other things that could be associated, right? Everything from, genetics, cholesterol levels, your diet, are you stacking a bunch of other things that could increase risk? There's other risk factors to cardiovascular disease, to having a heart attack, other than just somebody being on testosterone. And this study did a very good job at stating and looking at all of those individual factors and putting that into play, that testosterone itself was not the catalyst. So, my opinion, testosterone by itself does not increase your risk for having a heart attack.